When I was a boy, I used to come in this hospital, and it's an honor for me to work in this hospital and an honor for me to serve this population now as surgeon.
In 1956, in the rural Artibonite Valley of Haiti, Dr. Larry and Gwen Grant Mellon built and staffed a medical complex that fit the needs of a neglected rural population. Over half a century later, the hospital is still a perpetual swirl of activity, fully engaged in the life of the community and addressing significant health challenges. HAS Haiti is an integrated health system dedicated to prevention as well as cure. Hospital services, including surgery, obstetrics, pediatrics, and internal medicine, are joined with community health clinics, water projects, environmental and economic development efforts to provide a healthier, better life for 300,000 people.
We have an outpatient clinic. We saw children that comes for follow-up after hospitalization. We see children with sickle cell anemia, children with tuberculosis, malnutrition. All these children are seen in an outpatient clinic. So we have a very good program also for malnutrition children. They go to the mountains to find them and bring them here so they can be managed at the hospital.
HAS operates a network of community health clinics spread throughout its 610 square mile service area.
These dispensaries in the mountains are very specific towards malnutrition. Dispensaries and field activities as mobile clinics and as rally posts are mostly towards preventive care and also doing a lot of education and hitting the diseases early before they actually get in a critical case where they would need the hospital. Community services integrated. It's hitting a problem on its multiple sides.
Fully staffed with Haitian doctors and nurses, HAS is one of only a handful of referral hospitals in Haiti, providing advanced surgical care. HAS regularly treats patients who suffer from malaria, TB, HIV/AIDS, and malnutrition, which are all too common. Visiting medical professionals from around the world work with and train a permanent Haitian staff.
Moi, c'est Hélène Clairvius. Moi, c'est une étudiante en médecine, 4e année. Je étudie dans l'université Kiskeya. Moi, je suis de Chapelle. Moi, je viens de l'hôpital Albert Schweitzer, c'est juste pour me faire pratique. Si l'hôpital là-bas empile mon travail, Et puis, moun sa yo gen posibilite, yo voye ti moun yo l'école, ça réduit mortalité dans zone nan et dans vallée ya. Pour moi-même, l'hôpital là, c'est des chapelles. Sans l'hôpital là, pas des chapelles.
We don't have many hospitals like HIS in the country. You can count them with your fingers. It's an important hospital for this community and also for the country. Yeah, it's important. It's important. We can receive patients from everywhere. We never know. If we refer to the earthquake, we can understand what happened. We receive people from the south of the country, from the north of the country, from Port-au-Prince, from everywhere. Because people needed care, they have to go somewhere. So they heard about HIS, they came here.
Following the earthquake, despite being overwhelmed with huge numbers of emergency patients, the Haitian doctors and nurses at HAS worked around the clock to provide life-saving assistance.
I remember every time I go home, I only had the time to drink something. You say, I should do something. I should go to the hospital and to help these people.
Li montre elle fait 7 jours en babé comme au prince. Il fait 7 jours en bas Kaila en babé comme pour mourir. Et il tourne pour la 7 pour mourir celle de femme. Parce que est municipal.
The first day after the earthquake alone, an entire month's worth of medical supplies were used. HAS continues to face numerous challenges. To escape the devastation in Port-au-Prince, tens of thousands have arrived in the HAS service area. More will come.
A person traveling from another area would also bring in new diseases. So we tried answering to this, giving preventive care, vaccination to children under 5 and also to women in childbearing age.
Many who survived the earthquake are now amputees. They need artificial limbs and physical therapy. In conjunction with US-based Hanger Orthopedic Group, HAS launched an on-site prosthetic factory and rehabilitation center. HAS plays a significant role in the future of Haiti's healthcare by serving as the very first of 8 planned centers for artificial limbs. Demand for a prosthetics and rehabilitation center was high before the earthquake, and now is even greater. The program complements HAS's Rehabilitation Technician Training Program to build professional infrastructure for rehabilitation services in Haiti, starting with physical and occupational therapists.
in Hospital Albert Schweitzer, people receive very good medical care. When people come here, we don't see only the disease. We see the entire human being, and you don't see the disease. So that's what I like here.
You only have to compare what is happening here and somewhere else. You only have to visit this hospital and visit other hospital, and you will see.
HAS is like the soul of the chapel. Without HAS, I think that this area will die.
Change in Haiti has created an enormous strain on HAS's finances.